Over the last 24 hours, we have identified 6,010 new cases of COVID-19 and completed about 14,350 tests. Our positivity rate for lab-confirmed cases is 40.9%. There are currently 786 people with COVID in hospital, including 79 in the ICU. Sadly, 8 new deaths have been reported to Alberta Health over the last 24 hours. You have heard me report these numbers for so long, it can be easy to forget that each of these numbers is a person. Whether it represents someone in hospital or in ICU, or someone whose family is grieving their loss, these numbers matter. Lives lost to other illnesses also matter, and I extend my sympathies to all who are experiencing grief right now, no matter the cause.
Every Albertan is eligible for a new, free 5-test kit every 2 weeks as long as supply is available. And we're working every day to get that supply. Since mid-December, we have distributed nearly 4.85 million rapid tests to pharmacies and health sites across the province so that anyone with an Alberta Health Card could go pick up a kit. And I should say that's on top of about nearly 9 million tests that we had already distributed, rapid antigen tests to high-priority organizations like homeless shelters, nursing homes, and the like. As announced last month, Alberta's government has directly purchased another 10 million tests on top of the federal government's procurement, plus 3.7 million additional tests this month in January. So, though there have been some delivery delays because of supply chain problems that the world is facing, we've already received 2 million of these tests, including 1 million that arrived in the province by air last night. An additional 3.7 million tests are expected sometime this week, and 3.5 million directly purchased kits are expected next week. So unfortunately, earlier this week, the federal government advised us that the rapid tests we were supposed to receive throughout January will come later than expected. All we know is that they have said they'll ship us 16.25 million tests in the month of January. With no confirmed dates for the arrival of most of the supply into the province, it's difficult to plan and to let Albertans know how they can access more tests. First of all, my understanding is that we've allocated about 50% to about 50% of the schools, and I've spoken to parents whose kids have received both masks and rapid test kits. So we know, I just know anecdotally that a lot of schools have been covered, but we can't deliver tests that we don't have. We're banking for weeks now on large federal deliveries that have not come through, which is why before Christmas, we did an emergency approval of our own procurement of 10 million. Now, those kits have also run into delivery delays because of global supply chain problems, but also everybody's been trying to get access to these test kits at the same time. The fundamental problem, Julie, is this, that the Health Canada has only approved about half a dozen different test kits for use in Canada for rapid antigen tests, which means there's a very small number of suppliers that we can buy from.